Good morning, my name is Michelle and this is my head to toe health assessment. I am going to come, gather my supplies, I'm gonna clean up my hands, I'm gonna knock on the door and come in and introduce myself to my patient. Good morning, how are you? My name is Michelle. I will be your nurse today. Before I proceed and explain you what I am about to do, I would like to identify. Can you please tell me your name and your date of birth?
Jessica Ocasio, 1586.
Jessica Ocasio, 9/15/86. Correct. So I will be doing a head to toe assessment, and you agree to record this head to toe assessment. Is that correct?
Yes.
Are you still agreeing or are you changing your mind?
No, I'm agreeing.
Okay, if you feel uncomfortable at any point, please let me know and I will stop. So I am going to position my patient. I am going to make sure you are comfortable. And I am observing her behavior. Her behavior is appropriate. So Jessica, can you do me a favor? Can you verify your full name, where you are, and what are we doing?
I am at Excelsior Hospital. We're doing a head-to-toe assessment, and my name is Jessica Ocasio.
Perfect. Do you know what day is today?
Today is May 6th, 2023.
Perfect. So I am going to start by doing a head and neck assessment. So I am going to be touching your head. There is any lesions or any fluids that are coming out of your skull that I should be aware of.
Not that I'm aware of.
Okay, even though you are saying that nothing is coming out of your skull, I'm still gonna use gloves just to make sure I don't come in contact with body fluids, if that's the case. I am gonna clean my hands. And I am going to use gloves. So I am going to be touching your scalp. Are you comfortable, Jessica?
Yes.
There is no deformities. Your head is round, no bumps or lumps. You can relax your head for me. So I am checking your ears. Your ears are symmetrically equal. Your eyes are symmetrically equal as well. Your neck, I'm observing your neck. Your neck doesn't have any lumps. Your skin in your neck is fine. I am going to observe your pupils now. So I am going to use my pen light. So if you can please look straight. Your pupils are equally round and they are reacting to light. So I am going to check your lips and your oral cavity as well. Is that okay with you?
Yes.
Open up your oral cavity is pink and moist. Your lips, there is no cracks, they are pink. They're not dry. Your teeth are white, there is no cavities as well. I am going to also check your arms. I am going to touch for your skin temperature. Your arms are warm. I am going to do your radial pulse. They feel strong. I am also gonna check for her strength and her extremities. Are you able to press my fingers, please?
Yes.
As tight as you can, honey. Her strength, it's equal bilateral. I am going to check for her capillary refill. I am going to be pressing in your nail. Capillary refill is less than 3 seconds. And I am going to proceed to expose your chest. And I am going to I'm going to check for your apical pulse, okay? Before I proceed to the apical pulse, I would like to do a sensation test. Are you able to close your eyes for me, please? Do you feel me touching you?
Yes.
Where I'm touching you?
In my right hand.
Where I'm touching you, Jessica?
My left hand.
Can you be more specific?
It's in my thumb.
Do you feel touching?
Yes. In my left pinky.
Where I'm touching you?
In my right ring finger.
She has sensation in bilateral bilateral arms, bilateral hands. So I am going to point my stethoscope and I am going to listen for your apical pulse. I am going to check for my mid-clavicle intercostal fifth space. That's where I am going to locate my apical pulse. 1, 2, 3, 4, and 5. On next stretches. Thank you. Please. Are you comfortable?
Yes.
I am going to check for 1 full minute. So now, Jessica, I am going to auscultate your lungs and I am going to check for the skin turgor. I am gonna pinch the skin in your clavicle. The skin has elasticity and is not dry. I'm going to listen for her lungs. I am going to listen anteriorly first. Now I'm going to check lateral. I'm going to expose your chest. Anterior and lateral low sounds are clear. And I'm going to check posteriorly. If you can please have a seat. back, Jessica, please. Posterior lung sounds are clear as well. Are you comfortable, Jessica?
Yes.
So I am going to proceed and expose your abdomen. Is that okay with you?
Yes.
I am going to observe for her skin and the abdomen first. Her skin is clear. The shape is round. It's a medium size. I am going to listen to your abdomen. Is that okay?
Yes.
Vowel sounds are present in the 4 quadrants. Now I am going to proceed and palpate the abdomen. Slow. Any pain, Jessica?
No.
Abdomen is soft, not tender. Now, Jessica, I am going to check your lower extremities. I am going to expose you. I am going to check for a skin temperature first. Skin is nice and warm. I am going to remove your socks. Is that okay with you?
Yes.
I am going to check for edema. There is no edema present. I am going to check for capillary refill. Capillary refill is less than 3 seconds. I am going to check for pedal pulses. Pedal pulses present and bilateral extremities. Jessica, I am going to check your range motion. Can you please bend your knees and push your leg up? Perfect. Let me check your skin under your heels. Can you elevate the other hand, the other foot? Thank you. Bend your knee. Any pain?
No.
I am going to check for strength as well. Can you please push your, perfect. Can you push them down? I am going to check for sensation. So I want you to close your eyes. And do you feel touching?
Yes, on my left upper foot.
Where I'm touching you, honey?
Left upper foot.
Where I am touching you then?
On my right upper foot.
Where I am touching you?
My left pinky. My left big toe. Right pinky toe. Left pinky toe.
Her sensation is fine. I'm gonna put your socks back on.
Thank you.
Are you comfortable?
Yes.
I am going to follow you, Jessica. So Jessica, I wanna sit down. And I'm gonna chat with you, and I would like to talk to you about a topic that you will be interested in and get some education.
I have some concerns. I've been feeling a little bit off, a little bit of headaches. So I went to the doctor recently and he said something about my blood pressure being high and maybe checking for hypertension. What does that mean?
That means that the levels of your blood pressure is out of range, out of the normal. One way that you can help yourself bring those numbers lower is nutrition and exercise. When we talk about nutrition, it will be good for you to consume less sodium, when I talk about sodium, I meant low salt. So if you cook at home, try to minimize the salt that you utilize in your meals, and try to avoid foods that they are in can, like ham, franks. Those are type of foods that they have high levels of salt. Also, potato chips, those also contain a lot of salt. Exercising will be another way that you can help yourself and bring those numbers down.
Okay.
Walking around your neighborhood 2-3 times a week, that helps. Thank you so much, Jessica, for allowing me to do the head to toe assessment. I really appreciate it. This is the end of my assignment. Thank you.